Guys, to Anatomy Lab week 2. So in this week, we are going to finish up a few of the head structures, and then we'll move down into the neck and begin looking at some of the thorax structures in preparation for speaking about the cardiovascular system next week for Lab 3. So let's go ahead and get started. So let's finish up the head. Let's look at the salivary glands. So the salivary glands are paired structures located in and around the oral cavity, and they are responsible for secreting and releasing saliva, which we know is important in not only the digestive process, but a part of the immune protection in the oral cavity. So we've got three salivary glands. The parotid gland, which is the largest, is located at the lateral aspect of the oral cavity. And we can see the masseter here for reference to show us exactly where this is. Then we have the submandibular gland, which is inferior to the oral cavity, along with the sublingual glands, which are inferior and anterior underneath the mandible. I also want to point out the parotid duct, which is a large duct often associated, again, with the masseter coming from the parotid gland and emptying its secretions into the oral cavity. Right? So we've got the parotid gland, the parotid duct, the submandibular salivary glands, and the sublingual glands. Let's talk about the teeth. Now we know the general purpose of teeth are crushing, tearing, biting food, mastication, which is the beginning of the digestive process in the mouth. We've got 32 teeth in total in a fully developed adult mouth. There are 8 teeth in 4 quadrants. So each quadrant has 2 incisors. And the incisors are these flattened teeth at the front. These are the kind of teeth that are showing when you're smiling. We've got 1 canine, so these are the sharper teeth that are usually located in the corners of the mouth. We've got 2 premolars, so the premolars become significantly larger and a bit more block-shaped than the incisors and the canines. And then towards the posterior aspect of the oral cavity, we have 3 much larger molars. Now, the canine and the incisors are usually involved in actions such as tearing or shearing or biting into food, whereas the premolars and molars are involved in crushing, in grinding, really in chewing that food in the back of the mouth. I also want to point out that the third molar is often described as being the wisdom teeth. These don't erupt until later on, beyond puberty most of the times, and sometimes even well into early adulthood, age 21, for instance. In the corner here, in the lower left corner, what we can see are the 2 sets of teeth that an infant is usually born with. So we can see the deciduous teeth. These are what we call the teeth that are kind of stuck up in the gums. And then the first row of teeth, which are the primary teeth that an infant will erupt, will eventually drop out by the time they're about 6 or 7. And then the more permanent teeth will come down into the sockets, and then those will be there until, well, throughout the rest of their life. So we've got 32 teeth total, 8 teeth in 4 quadrants, and those 8 teeth are 2 incisors, 2 canines at the front, and then 2 premolars and 3 molars towards the back. Again, some of the structures here in the oral cavity, we can talk about the frenula. So the frenula is a collective name for these 3 structures, and they're basically just a flap or piece of connective tissue that is anchoring the lips to the gums. So the superior frenulum anchors the top lip to the top gums. The inferior frenulum anchors the bottom lips to the bottom gums. And then the frenulum of the tongue, sometimes called the lingual frenula, anchors the tongue to the floor of the oral cavity. right? So the frenula are kind of important in stabilizing the mouth, especially when we bite and chew and speak. And so it prevents the teeth from kind of going everywhere, or the gums from moving around with respect to the lips and to the other aspects of the oral cavity. So it kind of stabilizes the mouth for chewing and speaking and so on. Okay, the tongue. So the tongue, we all know, has lots of functions. We've got thermoregulatory sensation. So the tongue helps to decide the temperature of food. We've got taste buds located throughout the tongue, which help us to discern sweet from salty, from umami, from bitter. And then the tongue also is important mechanically for moving food around in the mouth and getting it towards the teeth so that it can be properly crushed and ground and masticated. There are two muscles that make up the tongue. So this sagittal view gives us a nice view of the broad kind of fan-shaped genioglossus muscle. So this is a much bigger part of the tongue, the bulkier muscle of the two. And then the much smaller geniohyoid muscle is the strip underneath, which connects the mandible to the hyoid bone. Alrighty, so we've got the genioglossus muscle and the geniohyoid muscle. And just to kind of look at some terminology here, genio means pertaining to the chin or in the chin region, and glossus means pertaining to the tongue, right? If you think about the glossopharyngeal nerve, which is one of our cranial nerves that innervates movement to the tongue. Okay, looking at some other really important structures in the oral cavity, we've got the hard palate. We've encountered the hard palate before. The hard palate is part bone. Well, it's all bone, but the palate is part bone and part connective tissue. The hard palate is the bony part of the palate. And we know that it's made by the palatine bones partly and the palatine process of the maxilla bones, which are paired. And the palate obviously separates the nasal cavity on top from the oral cavity, which is preventing us from swallowing, which is preventing us from regurgitating food that we swallow back into the nasal cavity, so we don't obstruct the nasal passage as we chew and eat. We can still breathe. The soft palate is the projection of the palate, which is made of connective tissue, and the soft palate ends in a structure called the uvula. So the uvula is typically what you see when you look into someone's mouth. You usually see a piece of flesh that's dangling. That is the uvula, and that's just the ending of the entire palate structure, but it's only connective tissue. Then we can talk about the tonsil. So the tonsils are often confused with the salivary glands. One, because they are paired and they are located in the oral cavity. So it's really important for you to distinguish the structure and the location and the function of the salivary glands that we talked about prior. And then what I'm going to talk about now, which are the tonsil group. So they're also paired, but these are lymphatic aggregates. So they're aggregates of lymphatic tissue, meaning that they play a role in our immune response, especially as different pathogens may be introduced into the mouth and the oral cavity. It's really important to have these aggregates that can mount an immune response should bacteria or viruses or any sort of other pathogens enter the oral cavity. So we've got the palatine tonsils, and the palatine tonsils are located on either side of the oral cavity, right? So remember, the palate is going to be the distinguisher or the demarcation between the nasal cavity and the oral cavity. And so the posterior aspect of the oral cavity, we have the paired palatine tonsils, one on either side. Then we've got the lingual tonsils. The lingual tonsils are at the base of the tongue. So if you were to look completely towards the back of the tongue, which you couldn't see because of the curvature of the genioglossus muscle, but if you were to go all the way to the base of the tongue where the epiglottis is found, I'll talk about the epiglottis later on, this is where you would find the lingual tonsils. And then finally, we've got the pharyngeal tonsils, often called the adenoids. These are probably the most important group of tonsils. These are the ones that are often inflamed and have to be removed. And so they're found at the superior aspect of the pharynx, the nasopharynx, right? So here's the nasal cavity, here's the nasopharynx, and then at the superior aspect of this space, we have the pharyngeal tonsils or the adenoids. Now, an important landmark for that is they're going to be really close to the eustachian tube, and this is the ear-throat connection or the pharyngotympanic tube that we talked about in last week's unit. So often if you heard someone who had to have their tonsils removed or had to have a tonsillectomy because they got really inflamed, they usually present by blocking the airway. So you can see where they are. If they get inflamed, they can completely block the nasal passage and make it hard to breathe and just create a lot of spread of infection that's possible in that region, either to the nasal cavity or into the middle ear. So we usually remove the pharyngeal tonsils when they get inflamed or if they begin to create mechanical problems. Okay, let's talk about the neck here as we move away from the head, and we'll look at a few of the important structures that are in the neck or in the airway, as I like to call it, the pharynx, so to speak. So we've got the epiglottis, and the epiglottis is the covering to the airway. It's a flap of part cartilage and part connective tissue that actually comes down and covers the opening into the airway. It's often called the guardian of the airway because of this. And so whenever we swallow food, in order for that food to not go here, but to go in the posterior structure, which is the esophagus, the epiglottis must come down and kind of guard or cover the airway. Then we can talk about the esophagus. So the esophagus is the muscular tube that sits posterior to the trachea, which is the cartilaginous structure which guides air into the lungs. So we've got the air pipe, so to speak, and the food pipe, so to speak, and they must be kept distinct. We also have the larynx, and the larynx is really the opening or the inlet to the trachea. It's also called a voice box because the vibration of the folds that are located at the larynx are what produce voice. So as we move air past these vocal folds, this is what produces the vibration that gives us voice or sound and allows us to speak. And so for that reason, we call the larynx the voice box as well. Now, before we go any further, I want to sort of differentiate or define the different regions of the pharynx. So I talk about this entire region as being called the pharynx, but there are three divisions. So the posterior aspect of the nasal cavity is called the nasopharynx, shown here in a lime green. The posterior aspect of the oral cavity is called the oropharynx, and then the posterior aspect or the inlet to the larynx is called the laryngopharynx. So we've got nasopharynx, oropharynx, and laryngopharynx. The laryngopharynx is sometimes referred to as the hypopharynx. Alrighty, let's look at a few of the cartilages that are found at the larynx. So the larynx is made of partly cartilage, the thyroid cartilage being one, the cricoid cartilage being the other. So here's a larger thyroid cartilage. And then inferior to that is the smaller cricoid cartilage. And this allows several connective tissue membranes and muscles to run around this cartilaginous structure. And these are the muscles that move the vocal cords that either relax or contract in order to tension or to relax the vocal cords and can alter the sound of our voice, the pitch of our voice, and this is how we can intonate when we speak by the membranes and muscles that are connected to the thyroid cartilage and the cricoid cartilage. We've also got the hyoid bone here for reference. We were introduced to the hyoid bone before. It's one of the only bones that is not articulating with another bone. It's found kind of in the inframandibular region, and it's also an anchoring place for the muscles and membranes that I just talked about. Now I want to point out the laryngeal prominence. So the laryngeal prominence is this kind of V-shaped bump found on the anterior aspect of the thyroid cartilage. It's what we usually call the Adam's apple in layman's language. So if you usually wonder why males have a prominent Adam's apple, this is what we're talking about, the laryngeal prominence. And this is responsible for the deepening of the voice in males beyond puberty. Basically these cartilage, this cartilage is exposed to different hormones during puberty for males than it is for females. And that is why the voice deepens as this bony structure becomes bigger in males after puberty. I also want to talk about the thyroid gland. So the thyroid gland is located anterior to the cricoid cartilage. And so there's often a kind of a misnomer here where we think that the thyroid gland is associated with the thyroid cartilage, but it's actually found a bit lower, and it's superior poles. So the superior poles of the thyroid gland come in contact with the cricoid cartilage and not so much the thyroid cartilage. And we should know what the thyroid gland is, right? The thyroid gland is one of our endocrine glands responsible for producing thyroid hormone. We spoke about this last semester. All right, let's look at a mid-sagittal view of the larynx. So we can see here the epiglottis that I talked about, the guardian of the airway. So the epiglottis would flap down and cover this opening. We can also see the internal structures of the larynx. So the two folds are the vestibular folds, which are often called the false vocal cords. And then the actual folds that are involved in voice production are the vocal folds, which are often called the true vocal cords. And just to kind of describe this, the vocal cords, the true vocal cords that is, or the vocal folds, are more medially located with respect to the vestibular folds. So the vestibular folds are going to be a little bit more lateral and superior, whereas the vocal folds are a little bit more medial and inferior. And I'm sure we can see that on another view, but on a sagittal view, we can see that one is above the other. So here's a superior view where we can see the relationship of the vocal folds and the vestibular folds. So what we're seeing here in white, closer to the center of the inlet, the opening down into the trachea or the larynx, is the vocal folds or the true vocal cords. And slightly off to the lateral aspect and slightly superior, we'll find the vestibular folds or the false vocal cords. And then for reference, we can see the epiglottis here, which will flap down and cover this opening. And then posterior, we've got the esophagus, where food will move past the epiglottis and enter.